Thank you for joining us for this week's episode of Mommy Talks with me, Karong'o. This month we focus on the child, and to start us off is Dr. Kabui Kaguongo, a pediatrician at the Gertrude Children's Hospital in Muthaiga, to talk about delayed milestones in a child. Stay with us. Today we want to discuss about developmental delays in a child. So we can start by defining what is a developmental delay.
Okay. So to understand developmental delay, you need to understand first what developmental milestones are. So these are skills or abilities, or sometimes even just behaviors, that a child picks up and learns during different stages of their growth. And the reason why they are important is that it helps us to assess whether this child's brain, for example, is developing normally, their physical bodies as well. It's more than just being healthy, but are they also developing both holistically? So then when we talk about a developmental delay, we have normal ranges for these milestones. And although when you go online on the internet, you'll see at 2 months your child is supposed to do this. Yeah. It's usually not quite that clear cut. It's more like a range between maybe 2 to 3 months, or it depends on what the milestone is, but you'll have a specific range. So it can be difficult to say what a delay is exactly, but for most mothers, what will happen is that they'll notice that other children, their child's age, have started doing some things which their child is not able to do. So then we start investigating what's the reason for that delay might be.
There are various categories of developmental delays.
Yes.
Maybe you can take us through them.
The categories of developmental delay are similar to the milestones. So we have what we call domains, and we have 4 of them. So we have physical milestones, we have cognitive milestones, we have language, and we have social. They sound like they're different things, but they're actually interrelated. So I'll give you an example. When a child is born, generally they have no neck support. And what that means is that you'll notice everyone, when they carry a little baby, they have to support the head. And it's because if you don't, it sort of falls back. So as they get to about 2-3 months, they develop that neck support. So on the physical side, that's what is happening. That's the physical or the motor milestone for that age. But then on the cognitive side, other things are happening. And the social side, at around the same time, the child, for the first 2 months of life, the child will mainly focus on the mother as they're breastfeeding, and that's the extent of the interaction. But the minute they get neck support, they start being interested in their surroundings, because now at about 2 to 3 months, they're starting to lift their head up when you put them to lie down. So they're interested in other things. That's about the time that when they start interacting with their environment, 4 or 5 months, they also start babbling, and they'll say ba ba ba. So all of them develop in tandem, and you can have a delay in any of those areas.
Okay. Are there some key specifics that a parent can look out for to know that their child is having some delays?
Okay. That's a good question. And actually, let me go to the biggest resource that every mother should have, is your Well Baby booklet. So most of the Well Baby booklets, there's a page, where it shows at this age your child should have done this. I think that's a good way to start as a guide. So it'll give you a specific, it will say at 2 months your child should have a social smile, which means when they hear your voice, they should smile. When they see your face, they recognize you. When you smile at them, they should smile back. So when you have that guide in your Well Baby booklet, as your baby grows up, you can have a look and see, my child is 3 months, okay, a month might not be too big a difference, and you keep an eye on it for another month and see what's going on. But use the resources available to you. The nurses at your Well Baby clinic, your pediatrician. Their scheduled visits usually at 6 weeks, 6 months, and 1 year, and more frequently if your child needs it. So at each of those visits, we tend to want to assess the developmental milestones. Sometimes we watch for a little bit before we say, okay, this is definitely a delay. But most times you can tell when you look at all 4 domains if a child is within the normal or if they're lagging behind. And obviously the earlier we intervene, the better. So in terms of what mothers should look out for, I would say first, follow the Well Baby booklet. It should give you milestones up till about 5 years. Secondly, a lot of mothers come to us because they've noticed other children my son's age are running around playing, but my son just sits in the house. So if you see something that's a bit different from other children, let me clarify and say, I don't mean that we should be saying it's 6.5 months and you have no teeth and your brother had teeth at 7 months or at 6 months, and it doesn't quite work like that. But within a reasonable range, within 2 to 3 months of other children being able to do certain things, your child should also be growing in tandem with their age mates. So I'd say don't compare with one specific child, but generally the age will tell you. If almost everyone else that age is able to do something and your child isn't, come, let's have a look.
So if it goes beyond 3 months to the time when the child was expected to have a certain milestone, that's when you should seek help.
I was really avoiding putting a specific date because for some milestones, even 1 month is too much. There's no set cutoff. But at the point where you get concerned, I guess what I want to say is there's no stupid question. At the point where you get concerned, don't be afraid to ask about it. The good thing is that well baby clinics are every month. So even when you think it's early, ask. Let's have a conversation, because again it varies widely. It depends a great deal on what the milestone is and what else is happening in the child's life. If your child was recently admitted, for example, for a pneumonia, I wouldn't be surprised if it sets them back a little bit. Maybe they should have been sitting at 6 months, but they were in the hospital for 2 weeks when they were 5 months old. So then I give it a bit of leeway. I say, okay, maybe that's why we are a little late, and we give it a bit of time. So there's no one size fits all answer. So I think the answer is, when you're concerned, please come, ask the question.
Are there any specific causes to developmental delay?
There's a number. And I guess the way to look at it is the big categories. So some is genetic. Some is that the way during delivery, either your child perhaps was a preterm and they had some struggles. So for preterm babies, there's several things. One is that they're born earlier than usual. So they haven't even completed their intrauterine, the things that they should have done and grown and developed in the womb, they're not done yet. So to expect them to meet their milestones at exactly the same age as their age mates who were born at full term is not reasonable. It might take a little bit longer. They do eventually catch up. So that's the first thing. But then secondly, preterm babies also have a bit of more of a difficult time when they're born. The first few weeks of life can be rough, and that can also affect their milestones. Any injury, even at birth, afterwards, even what we were talking about, like a child who's sick in infancy, can affect your milestones. And by affect, I mean it can delay or it can cause what we call a regression, which means that, for example, my child was able to walk, but for the past month they've been so sick that they've not been able to walk. So had achieved the milestone and now we've taken a step back. So that can happen as well. Then there's milestones that are associated with physical illnesses or with syndromes. So for example, Down syndrome can cause some delay. And so if your child has been diagnosed with a specific condition that we know is associated with developmental delay, oftentimes we don't even wait to see the delay. We intervene early. We support the child so that what we are doing is we are targeting the milestones. We are aiming to reach them rather than waiting for them to be delayed and correct. So yes, there are different things but that list is by no means exhaustive. But there's lots of things, cerebral palsy, autism, sometimes even things like malnutrition. If your child is for some reason not able to get a balanced diet or they're not able to absorb their nutrients, it affects development. So the thing to remember is that everything is interrelated. Your diet, your environment. If your child doesn't interact with other people, their milestones can be delayed because of that.
Does home environment also interfere? Maybe if it's not, let me say, maybe in a home there is violence, or does that affect development of a baby?
Actually, I'm glad you asked that, because one of the things that we think about when we see a child specifically who has regressed milestones, a child who was previously potty trained, for example, and then they start wetting the bed, is we start asking ourselves, is there abuse here? Is there some mental stressor? Is there something at school? Is there someone at home who's harassing this child? And abuse can be physical, it can be sexual, it can be emotional. We gaslight our children. We tell them, you're not good enough. Look at your brother. We sometimes do that without realizing we are doing it. At the same time, we live in a society where even competition is frowned upon for our children, and yet it's part of growth. So everyone gets a medal for participating, which is great when you think about it on the surface, but then what pushes them to be better? So what we need is balance. So yes, if there's violence in the home, if there are any extremes, it's a bad thing, and it will affect the child's development. Either that their development will lag behind, that it will actually reverse, go in the wrong direction, or that they'll develop in ways that are not seemly. Children mimic, they act out what they see.
So what can a parent do when they notice that their child may be having delayed milestones?
Okay. First thing is seek help and seek help early. Don't wait. The first thing that we will want to do is find out why is this delay happening. Some of those causes are completely reversible. So for example, we talked about nutrition. If the problem is malnutrition, once we fix that, your child should catch up fairly well. If, however, the delay has been there for a very long time, or if it's caused by some of our irreversible causes, so for example, cerebral palsy is not something that we have a cure for at this time. And what then happens is that what we want is to get the best possible life for that child. So you'll find that even for children who have delay, there are levels of delay. So I might say, okay, my child has a developmental delay, but I don't know, does this mean that they're going to walk when they're 6 years old as opposed to walking when they're 1 year old? Or does this mean that they'll never walk? So those are some of the conversations that we have to have. For a lot of children, you get a marked improvement in function just by intervening early. Doing occupational therapy means that instead of your child staying in a cot for 3 years before they learn to walk, they can learn to walk at 2 years instead of at 1 year. So those are some of the things that seek help early.
Okay. You've mentioned about children watching cartoons and mastering cartoons before they can even talk. Does too much TV time affect development of a baby?
It's generally accepted that too much TV is bad for your child. When I was growing up, there's no way that you are going to spend the whole day watching TV. Mobile phones had not been invented, so you had to do other things. And those kinds of activities help your cognitive development and your social development. You have to go out and play with other children. We played kati, and those games where you also engage your body, so your physical development is also being prompted.
And then you improvise things.
And then exactly. So we didn't have high-priced dolls.
Yeah.
And I'm not saying that it's not a good thing to have those things if you can afford them for your child, but I think we should also give our children opportunity to make up their games as they go along.
Finally, can developmental delays be reversed?
In some cases, yes. It depends on the cause. Some cases, unfortunately, are irreversible, but I think the take-home message is that even for the cases of developmental delay, where you have irreversible causes, they can often improve function. Your child might never be, they might never be neurotypical. They might never be the average child, but then again, who is? We are all different in some ways. So I think our focus for every child should be to bring out the best for that child. And that means that even if they have what we would categorize as a speech delay, let's get them to 100% of their potential. let's not leave them at 20% and say, yeah, but they have cerebral palsy. I mean, they were never going to be whatever it is we expected them to be. Let's not place expectations on our children. They can surprise us. So make sure that they reach 100% of their potential, whatever that potential is. They can often be better than they are and then we think.
Thank you for staying with us. We hope that you've learned a lot from this episode. Join us again next week when we discuss eczema in children. We'll be joined by Dr. Catherine Gero, who will take us through what it means to have eczema and how it can be successfully managed. Until then, stay safe.